right, that one too.
Yeah. Go ahead and get on, and everybody go ahead and share now. That's the best time to do it.
Yeah.
While we wait.
Do I need to do something? No, we're gonna share the live.
Oh, gotcha.
Okay.
You can share it on yours if you want.
On my. I think I did earlier or yesterday maybe. I told the people.
Well, now we're live and you can share it.
Okay. I don't.
Yeah,
Not to be a snob.
We are live.
I always send it to my.
Are we live?
We are live.
We're live.
Okay. I didn't know what that is.
I'm in CS right now.
Can I do it? I can do that, and it'll show it to mine.
Yeah.
Sweet.
All right. Do you want to do the intro before we drink the tequila?
Whatever. No, let's go ahead and do them up real quick. Yeah.
Do it tequilas first.
Yeah.
All right.
Yeah.
People,
Yeah.
We're gonna do it.
Hey, you pour them up, and I'll start on the intro. You want to do that?
Yeah.
Yeah.
All right. Cool.
Whatever you guys.
I'm gonna go real slow on this.
For whatever.
All right.
Might be distracting for you. Might be a little distracting.
you said that. I've been talking about it.
I would wait. I would wait.
Yeah, people tell me all the time, they're like, what's the best thing about your Cybertruck? I'm like, autopilot. That's what he said.
Hit the second.
Hey,
Oh,
what?
dude, it will.
No, we're all-
Traffic, it will
Yeah.
put the turn signal on.
Oh, it's so awesome.
You don't have to be drinking to appreciate it.
You don't have to appreciate it at any
You
given
shoot
time.
with us, right?
You don't have to be drinking
No,
to
that's what I'm
appreciate
saying.
it.
You can
I'm
just,
saying,
boom, you can hit autopilot.
That last 30 minutes of sleep on the way.
Dude, it's killer.
All right.
All right.
Yeah. All right. That's
Cheers to
good.
Forever Young.
Cheers.
Cheers to
Forever Young.
Hey, thank you guys for the invite. I
Oh.
Thank you for
appreciate
coming.
it. Cheers. Thank you.
Do what makes you happy.
All
Tequila
right.
does that.
All right,
We'll do that.
There we go.
Yeah, we'll
right.
probably leave them.
All right, Justin, watch
Yeah,
out.
we'll leave those.
My man. All right. All right. Good evening and welcome to episode 75 of Them District Boys podcast. After y'all watch tonight's podcast, first thing I want y'all to do is hit me up, Brad J, Real Broker LLC. I want you to buy a house, your dream house, or a nice investment property. All right. After that, I want you to load that property up with some Marty Wilson art, right? After you get done doing that, I want you to go hit up Michael West down at DirectAuto in Goshen, right? Celebrate that. Go on down to Mayberry's Fine Wine and Spirits. Get you a nice bottle of champagne, right? Take you a couple shots of that, a couple of glasses of that. Head on over to Captain House for some steak and lobster, all right? If you get a little tipsy and you crash your car into your house on your way home, it's a really good thing that you have both insured with Jordan Duran over at Oliver Scott Insurance, baby. After that, take that car down to Collision Depot and get that thing repaired. And if you don't want it to happen again, I recommend you hit up Image Striping Company and get some lines put in your driveway so you don't wreck into your house again. If all that stress from one day caused about 10 years of aging, I got a solution. Tonight's guest can reverse that aging. Tonight's guest is the CEO of Forever Young. He can reverse that aging overnight. Y'all give my tonight's guest a warm round of applause. Kendrick McCarty.
Let's go. Thank you guys. Thank you guys. Thank you guys. I appreciate the invite.
Love it.
So we're gonna get in
Killer,
front.
man.
Yeah. Shout out to my uncle. Tommy Soche.
Yeah.
That's my uncle. So
Oh, is it?
he watches. He's been watching the podcast, and this is his first night being a sponsor. So if you need any
Nice.
seal coating,
It's been a little while since I've
thermoplasting.
seen Tommy. Tommy, what's happening? It's been a little bit.
but shout out to Young. So you're gonna reverse everybody's. We're going to this. You're changing the way people think about aging.
Yes, you have to. I mean, you can't get away from aging. Unfortunately, we haven't quite figured out how to stop aging.
Got to bring a little more up here.
You can't figure out. Okay,
No, you're good right there.
this
Yeah.
guy.
Yeah.
You can't figure out how you can stop aging, but what we can do is slow it down. Just like anything, we're a machine, man. We are a built machine, and things break down with time. Now, the sooner you recognize that, the sooner you listen to your body. It's all symptom based. The problem with modern medicine is they're not wanting to try to optimize. They're trying to make sure that you're not having a stroke tomorrow. That's about it. You know, when you go to your primary care, most of us, I mean, we're pretty similar age, regardless if you're 30, 40, 50, 60. You go and you see your clinician and you say, look, they're going to check your blood pressure. They're going to check your cholesterol. Make sure your kidneys aren't dying. Make sure your liver's not dying. That's about it. Okay. But there are a lot of dynamics that go into hormones and what causes people to have hormonal deficiency and the symptoms that are related to that. I mean, it essentially, man, what it is just basically taking your vehicle and putting a supercharger on it. I mean, it's really getting the best out of performance.
I want to switch into how did you get into this field, and where'd you come from, and what made you go, I'm about to learn this?
Man, so, I started early on. I liked the bodybuilding aspect. I liked exercise. I was a little squirt, man, when I grew up, man. I was scrawny. I was 120 pounds when I graduated high school. And I figured out that, dude, I could start lifting weights and get bigger. I could change my physique by exercise and performance. So now I got into it from an anabolic standpoint, when we know anabolics as steroids or, the steroid. Okay, but guess what else is a steroid? Estrogen. No one talks about that. You take estrogen as a steroid. Okay. No, insulin is a steroid. Okay. All that is a chemical compound. So the bad thing is these medications, these anabolics have been deemed steroids, and everybody looks at them with this kind of cold shoulder, like, I don't want that stuff. But it's a performance enhancing. It really gets your body to do better. Okay. It's basically taking a broken machine and getting it to perform better. So when I started in the bodybuilding, and you talk about making your body perform at its best, which is what I was into, taking the body and pushing it to the limits of performance, I enjoyed it. I wanted to try to figure out, man, how can I do that across the board and make sure that health is also associated with it? So the big problem is a lot of people get into bodybuilding. You think about being very unhealthy, even though you look jacked, you look a certain way, but they know from an internal aspect, you're not healthy. Well, the problem is there's a discrepancy between performance and primary care, and people that look at the body as just trying to make sure it doesn't break down versus making it the best that it can perform. That's the way I look at the body. So that's the only thing that really separates me. I mean, I just started in a world that was based on performance, and I brought it into the health field. I started in health a long time ago, learned about critical care. I was in critical care. I did pulmonary medicine, like lungs, lung deficiencies and cardiac disease. And then I got into orthopedics. So with all of my experience, you take that with the bodybuilding perspective of really enhancing performance, you bring them together. It's not a hard concept. It's just the problem is old clinicians don't want to learn about the new stuff. They're old dogs that don't want to learn the new tricks.
These old dogs are still operating.
They're still operating.
And they're still operating.
And
that's the
know.
problem. It's
Yeah.
the problem. It's because the new theory, continuing education, which is very important. I literally just got back from a conference a couple days ago out of San Antonio. I'm always wanting to learn. I want to know the latest and greatest. The problem is that's not the same that the OB and GYNs, the gynecologists that women are exposed to every year. Okay. They know that they're failing. They're told that from a very young age. You're going to go through menopause. You know that one day. Now, the earlier you pick up on that and you try to be more proactive, the better you can make that quality of life.
Well, let me check this real quick. Hold on one sec. Let me switch out.
Switch mics with me.
You already know you got audio problem?
I feel like
Like scratching.
No, I mean, I got it.
Ain't no good.
Yeah. Cool.
No, it's just your movement.
Yeah.
Hello. I'm good. So
Wait.
just no, that one's stronger than this one.
Okay.
Switching it out.
So,
Okay.
so your treatment is a preventive.
Michael J. Fox.
No, I just want to make sure when you're telling your story, I just want to make sure you tell.
Gotcha.
we're
Strong.
good.
Okay.
Good,
Yeah. No.
good,
So
and you're doing a great job. I just don't want people to be like, and it's so you're trying
In
to
and
tell.
out.
A story. Yeah.
it's fading out. So no, the way that I look at a body is I look to optimize. So it was it's goofy. It's kind of my little catchphrase was, I don't optimize, or hold on, how do I say it? I don't normalize, I optimize.
Yeah.
Because there's no such thing as normal. Like once you understand that there's no normal, my hormones are different than your hormones, are different than Jordan's, and different. Yeah. Everybody's a little bit different, where clinicians are restricted by these reference ranges that they're so scared to operate outside of that. They don't practice medicine.
Kendrick, when somebody comes to you
Yeah.
and they do blood work with you, what are you looking for?
I'm not looking for a number. I'm looking for you to say, hey man, I'm tired.
That's what I want to. That's what somebody wants to hear, though, because all these old school doctors are looking at numbers, and it's about how you feel.
You know what
right?
they say? You know, they say, I get all.
Well, how do you feel?
I get them all the time. They come to me and say, I went and had blood work 6 months ago, and they told me it was normal. I'm like, is your body
How do
normal?
you feel? Do you
That-
feel
How do you
tired as
feel
fuck?
good?
Yeah.
Do you feel
fucking
good?
range is
Range is, bro,
ridiculous.
And
Yeah.
not even just testosterone. Testosterone levels, you talk about 250 to 1100.
Oh, I know. I got
5 times
Yeah.
from the bottom to the top of being normal. So I
They
usually
call
tell
that
people,
normal.
I say, look, if we wanted to break it down and say, gauge your energy level on a scale from 2 to 9. And that's the easiest thing. That's number one complaint in my clinic. Fatigue, lack of energy, poor
Lethargic.
motivation, lethargic. And I say, look, tell me what your energy level is. Someone says 3. I say, cool. You know what? You're normal. It ain't optimal because there's another guy that says I'm a 9, bro. Like, I want to be a 9 at everything I do.
yeah.
You know what I mean?
Yeah.
I don't think we're not average dudes. I mean, we're not average guys. And I'm not just talking about guys. I'm talking about women. Women, I feel more sorrow for than
They need
men
more help than
because they
anything, yeah.
literally see their gynecologist every year and they're told the same thing. They're herded through there like sheep.
They're more lied to than
You know,
anything.
they're like this. They go in there, boom, boom, boom. They see their thing. They're out of there, knowing that their body is failing them every year. They get closer and closer to menopause.
And they trust that relationship.
They trust that relationship. That's the bad thing. But the problem is they're not taking the time out to find out the objectivity and the subjectivity discrepancy. Because when you look at even an estrogen, I've talked about testosterone being wide range, 250 to 1100. Guess what? A normal estrogen for a woman, 50 to 400. Now, just imagine what it takes for someone to be deficient. It's crazy because anytime you come in and say, "Yeah, I'm tired. I'm gaining weight. I can't sleep. I got night sweats," they're going to draw your blood work. And guess what? If you fight them to even get them to draw your blood work, they're going to look at it and say,
You're normal.
"You're normal."
Yeah.
And it's easy, man. It's just an easy way to basically get people to accept aging as the norm. And that's where I take a different approach, man.
Do you think a big part of that has to do with the other side of the medical world where, everything's a pill form now?
Yeah,
Yeah,
of
it's
course.
Like, you just take 3 of these a day. Grab you a couple SSRIs or whatever.
Huge. SSRIs, man. I'll tell you, it's funny that you bring up SSRIs because there is an algorithm in medicine. You go through and you study all these, different ways to treat people. Part of the algorithm that you're taught is to assess your patient, and they come in with these symptoms. Okay. Before, if they present with these certain symptoms, you go down this thing. It's kind of like tired. Okay, go over here. Do they have this? Do they have this? Okay, it's an algorithm. Okay, boom, you go down here. They're tired. They're depressed. Before you check their testosterone level, guess what you do? You go down the algorithm and you start them on an SSRI because you assume that they have depression. Because depression presents with the same symptoms that low testosterone is.
Yeah.
Exactly.
So instead of replacing a bioidentical hormone, testosterone, something you naturally produce, anabolic, great hormone. I'm a huge advocate for it. That's the testosterone.
Also has his
molecule.
hair. Also has his hair.
I got cool hair. I mean, of course, testosterone didn't kill my hair. And of course, there's always a vibe that people say, "Oh man, I don't want to start testosterone. I'm gonna lose my hair." I got less than 5% of people that really start testosterone and lose hair because we can dive into that. There's a DHT component,
Exactly,
family and genetics. But the problem is people are so quick to diagnose diseases that take this. Boom. Take a pill. You know why? Big pharma.
Big pharma.
Yeah, well,
Now we'll talk about peptides.
But I was
You
born-
talk about
I was
peptides.
I was born with cerebral palsy. They cut on my hamstring when I was 92, and I was a Shriner's kid. And every time I went to a doctor since, it's 5 Lortabs, Somas.
Yes, cerebral palsy.
Yeah.
What?
Yeah. I've been having my whole life. It can't get
Holy smokes.
But I just got ignored it. That's why medical marijuana has always been a big thing for the pain situation.
Pain.
But if they see me, they're like, see my records. They're like, oh, how many Lortabs you want? It's like
So easy.
oh, shit.
So easy to throw your medicine because you got somebody backing you. You have all these big pharmaceutical companies that want you to promote medications. That's why.
It's money. It's all
That's
about
why
money.
peptides. I mean, I don't know how extensive we're getting into, but I mean, the peptide world's gotten very big right now. That's why FDA keeps pulling all the peptides off the market because now if I give you a peptide that cannot be trademarked, okay, you can't trademark an amino acid. It can't be done because you naturally produce this. Okay. So you can't trademark or patent it, whatever you want to call it. Trademark, pay it, whatever. You can't coin it. You can't patent it. So what ends up happening is if I promote an anti-inflammatory peptide, which are great, by the way, guess what? You're just taking you're taking money out of all the NSAIDs, all the anti-inflammatories, ibuprofen, Motrin, aspirin. So they don't want those on the market. They don't benefit from them, so you snatch them off. Dude, it's crazy, man. Big Pharma, Rogan talks about it all the time, man. I mean, the same guys that are on his podcast are the same ones that are in my field that are really relying on the cutting edge of medicine, but we just keep getting the options almost kind of fumbled in your face, like, oh, man, let's do it. Snatch.
I'm on hormone therapy. I've been on since I was 35.
Should be.
So I'm 7-8 years in it. Anytime I try to, talk to my boys, they're late 30s or whatever, one of their arguments is, well, it's something I'll have to do forever. I'll have to keep doing it. Like if I start to do it, I'll have to continue to do it. I'm like, and I tell them, I was like, bro, when they put you on that blood pressure pill and that cholesterol pill and all that shit, you're gonna have to do that forever.
They're not looking to fix you.
It's preventive.
Well, here's the thing. I tell people this. All right. Most people that come and see me, they got problems. They don't feel great. They come to see me because they don't feel good. They feel like shit.
Yeah.
So I tell you, look, if you're a 3, okay, and I start you on testosterone replacement, which is the best anabolic hormone that your body makes, responsible for energy, sex drive, your performance, your recovery, your muscle retention, your bone strength. So now I take you from a 3 to an 8, and I tell you, hey, bro, guess what? You're on this for life. Who the hell wants to stop and go back to being a 3?
I don't remember my old ways. I don't remember.
Dude, nobody wants to. So it's hard to get back. The bad thing is getting somebody to realize something that they've never experienced.
Yeah. Do you ever feel like a lot of people though want to just be like, hey, Kendrick, make me look good? But no, but just like without like actually feel good. They're more like, I want my image to be better.
It's like aesthetics. Aesthetics is huge. But here's the same thing. The same thing that affect aesthetics are the same things that are hormone based. So if you have high cortisol levels from stress, where the adrenal gland is cranking out all this cortisol, it breaks down the insulin receptors, it breaks down the elasticity, and it gets deep, man. You're talking about hyaluronic acid and all these things that are responsible for keeping your skin nice and taut. All the women do this stuff, man. Makeup products, hyaluronic acid and vitamin C and all these things that really keep them looking good and keep their metabolism on par. It all comes down to optimizing the internal body, which is only breaking down. That's what I tell people. It's like this is the only thing that you understand that is happening on a daily basis. We don't get better as we go this way. No, we ain't Benjamin Button. We're not going in that direction, bro. It's like you are aging.
Benjamin Button,
man. It's like literally the guy that's aging in reverse. It doesn't happen. Now, we're not there yet. We talk about anti-aging. We talk about regenerative medicine. We're not really reversing aging. Okay. Nobody's really going in reverse. But look, just like a dog ages 7 to 1, you get that same dog to age 4 to 1. Guess what? He just bought 3 years for that. It's all about ratios. It's how quickly your body degrades. What do you want to call it? Degradation? I mean, degrades, apoptosis. There's some weird words. I don't want to get too savvy. It degenerates. I mean, when the cells, they call a thing called apoptosis. Cells are born and understand that they're going to break down in usually a 90 to 120 day process.
Well, what's the average age of a male?
After 30. So after 30, I'm glad you point that up. So typically people say, man, I'm 48 and I still feel pretty good. So what? You're 48. You're not 20. That's the way I think. You can no longer be the same that you were 20 years ago because you're dying, man. You only go in one direction. So the way that I think about it is this. Testosterone is the big factor when we talk about men.
Does test peak at 25? Is that what I've always heard?
Peaks at dude, you talking about nowadays?
Yeah.
Even different. Now you're talking about environmental stuff.
It's got to be changing now.
There's
things
big
in
studies.
foods and things like that.
There's big studies, man. You talk about, they've got Yale studies right now that has compared testosterone levels from 20 years ago and 20 years prior to that. When you talk about people that say, bro, they're not built like they used to be, it's because we're not built like they used to be.
Right.
all the environmental factors, all the preservatives in food, all the things that are in products, bro, hair products and soaps and all these things that are hormones.
Okay, think about this.
Deodorant. All this stuff.
Deodorant.
Okay, think about this though. Like, if you look out in the 1900s, the height of a person, to now, I mean, just the growth. Like,
they're astronomical now.
Yeah, it's crazy. 7 foot is like
Tomo with an Aspire Rejuvenation in Orlando was talking about that.
Bro, it's crazy. I'm little. I've always been little, right? So I got a 12-year-old boy. I go out to the baseball fields. Dude, these kids are 12 and they look like they're 6'8".
So you see what I see. You're seeing
crazy, bro. They look like Yao Ming walking around, bro. I'm like, who the hell did you drive out here, bro? This is an 11-year-old. If you forgot.
No, I had a like 14-year-old or 13-year-old. I was like, I'm 38. He's here, and it's like, and he's not like it's a weird build. He's just like a superhuman.
But
guess what?
The height versus testosterone, are you saying that testosterone is lower than it was?
Take that. All right. So now let's take that they are peaking much earlier because of the exposures, because of the environmental factors, because of the hormones that are being placed in the foods and preservatives. So guess what? You peak earlier, but guess what? You crash earlier.
Oh,
so now I'm seeing low testosterone legitimately in 26, 28, 30-year-old guys, where that was a thing that was not even a thing back in the day. I mean, you really weren't facilitating low testosterone and not even calculating it until after you were 30, when it was once believed that you lose 1 to 2% after the age of 30. This thing's happening way sooner now, because now you got this influx of hormones that are happening much earlier. Kids are huge. The little girls, man, are going through, they're starting their periods when they're like 9.
Yeah, that's what I hear. Yeah.
9, 10. It's crazy. So, I mean, they're experiencing these hormonal changes a lot earlier. And guess what? Obstetricians and gynecologists, the OBGYNs, dude, I can tell men, we got it easy. I mean, really, I can replete testosterone like that. The women are being exposed to oral contraceptives, these synthetic hormones, when they're 12, 13, 14. For all kind of problems, and they're synthetic hormones, and they screw them up, and it's really a bad thing, dude. I mean, it's really, I enjoy manipulating hormones, but I feel bad that I've been exposed to all the women that are just being neglected because they are relying, like you said earlier, you trust your provider. Every time they go to their provider and say, look, I just don't feel good. I'm not normal. This is not me. And what they do, they get their lab work. Sorry, you're normal. Bye. See you next year.
Well, you also look at that in the last 2 decades, it's pretty shitty on just, the marketing behind it, like the way people even have any knowledge of it.
It's crazy.
The only time you hear about any kind of health products is, I don't say this, a pyramid scheme.
It
is.
It's a money grab.
Or Life Advantage or one of these fucking brands.
Money grab, brother.
But I mean, saying but it's like there's so many. So people like it. It's like the late night infomercials.
Yeah.
It's like you get on the. It's like the 90-day transition. Like you want to look the best in 90 days. And that's you go after people like that. That's that's what you see as marketing. But then you come in and I can help you.
You're targeting these people because they're vulnerable.
So the female side of it, are you working with the females?
Of course.
More?
So it's funny that you say that, because when I originally opened up, I got into men's health. Loved men's health. Loved anabolics.
But you saw a whole nother
Well, what happened was I had all these men coming in, influx. I grew up here. I mean, I had a big footprint. I 15 years at the hospital here locally, so I knew a lot of people. So when they knew, because I enjoyed health, I enjoyed fitness, and they knew that I practiced what I preach, that's a whole nother subject. You talk about clinicians, and most of them look terrible, and they're trying to tell you what to do. But you got to practice what you preach.
It's hard to listen to somebody that doesn't look like the way you wish.
It's like going and hiring a coach that's sloppy.
That's always my argument. Like
you can't even.
This guy's talking to me about cholesterol, and he's.
So I didn't like that aspect of medicine where you got a lot of clinicians that are telling you what to do, but yet they look pretty terrible.
Yeah.
The problem was,
they went to school, right? They went to school. They never had to do anything healthy again.
Are you gonna hire a personal trainer that's 6'4" and 380 pounds? No. He better look like
You're gonna be
I don't
right.
know, some kind of Hulk Hogan.
When do you feel hey, Kendrick, when do you feel like you start breaking through where people actually paid attention to you though? It didn't start overnight.
It didn't start overnight, but the good thing was that people knew me already because of my footprint. They knew I was in bodybuilding. They knew I walked around, and I don't say like I try to advertise for myself.
And Doug, we will be having you on the show soon.
Is he
Doug's been on the show with me. I love Doug. Baseball season, I know it's about to kick off. We'll definitely have you on the show.
Okay, yeah. He texted me the other day, and of course, he always jams me up for he loves Cybertrucks. All right, so yeah, I was in San Antonio the other day, and he sent me this picture. I guess he was driving down the street, and it was like a bunch of Cybertrucks, and he's like, "Oh yeah, they're delivering them new refrigerators." So yeah, he jams me up all the time. So yeah, Douglas, we'll see you soon. But no, I love Doug, and I go to the gym. I go to his gym. I've been going to his gym for a decade. So I already had a footprint for a lot of people that look to me and say, look, this guy obviously knows what he does. He understands how to manipulate the physique. So it was easy for me to talk to men. It was getting people to understand that women needed help also. They go and see their gynecologist every other year. So here's the thing. So I started out as men's health. Everybody said, look, dude, you're in anabolics. You know testosterone. You look great. Tell me what you're doing. Help me. Okay. I'm experiencing this. I'm tired. I have no libido. I have erectile dysfunction. I can't lose weight. I can't sleep, yada, yada, whatever the fact is. So now what happens is guy comes in, husband comes in, right? I make him so much better. Next time I see him, dude, I feel great. But guess what? Now my wife sucks. You know what I mean? If you're both terrible, you both feel terrible. You guys
she can't keep up with his libido.
No, you're complacent.
Mm-hmm.
I mean, if both of you you don't even want to leave the couch, you've lost your motivation to have fun. You don't want to go work out because you have no energy. Even if you went to the gym, guess what? 0 results because your metabolism's in the dumps. Your insulin's up. Dude, we're at 72% in the United States overweight people. Overweight in the United States, 72%, 42% obese. That means over 30 of a BMI.
Preach.
You're a big boy, but you know what? Guess what? I'm obese because that's why BMI doesn't matter. You're thick. You're a big guy, but you're not. You don't meet the criteria. I'm talking about the guy that doesn't work out.
Yeah, I've lost 13 pounds and just
look great.
And BMI is bullshit.
You're great. BMI is bullshit.
So,
is what I'm saying.
Yeah, no.
Is when you look at me, literally, I'm considered overweight because body mass index doesn't compute.
No,
you just
muscle.
rock fucking solid.
I mean,
It doesn't compute muscle.
We're falling back to the 40s like military. If you're this tall, you should weigh this much.
Neck and waist.
What
It
the-
doesn't compute muscle.
Yeah.
So here's the problem. So I was having so many men come back and say, bro, I feel great. My energy's great. My drive is there. My libido's cranked up. I want to go hang out with my kids now. But you know what? Now my wife is not doing good.
Sucks.
Please see her. I'm like, yeah, I don't know. I didn't want to do it at first, but I literally was having so many women call my clinic and say, please see me. I'm 42 and my gynecologist will not run my hormone levels.
Wow. So our sister is one of them. And so all they want to do is put the pellets in.
Pellets.
And she don't like the pellets.
Pellets, dude, you can't manipulate them.
No, and then you can't control it. You got these pellets injected too. They got a slow release.
You cannot manipulate.
Something goes wrong, then you got to go back in. I mean,
guess what? Something goes wrong. Ride it out. You cannot manipulate pellets. I don't even do them. It's a money grab. Pellets.
Getting the pellets. Yeah.
Let's go into this.
You're okay with injections for women?
I only do injections for women.
Only injections.
I only do injections for women. Well, yeah. I mean, because I understand it. You know what I mean? Yeah. Could I charge you $700 and take 5 minutes to jam some pellets in your ass? That? Yes.
I think your mom.
I literally could do that.
Yeah.
But I don't back it. I don't stand by it. Because if I do that, and 2 weeks down the road, you are having terrible side effects because the dose was a guesstimate. And now guess what? You can't do anything about it. You got to ride it out. I call it the roller coaster. Can't do anything about it. The money is not why I got into it. I don't do pellets. I don't do creams.
Kendrick, do you feel so? For instance,
creams a waste.
I'm not topical.
I'm probably the least. I mean, probably really unhealthy here. Not too bad. But you say about people lack of energy.
Yeah.
I don't have fucking life.
Sucks.
Like for me, like I push myself every day I get up, and I
you push yourself though.
Yeah, but do you have people that come in there that just like you will give them everything they can, and they still do not see the results because they're not they're not pushing themselves, they're not enjoying the day?
Well, here's what you got to understand. Why are you not put? That's the question.
Yeah.
Why? My question to everybody is, okay, why are you so depleted by 11 o'clock in the afternoon? Is it because you have sleep apnea and you never really slept good? Is it because you're anemic? Is it because you're dehydrated? Is it because you're testosterone? Is it because you got too much estrogen? Is it because you have thyroid disease? Is it because your cortisol is too high? Is it because your insulin is too high because now you're resistant and you can't utilize your sugars? Literally, it's so dynamic that most people don't want to get into it because they don't understand it. And I'll take you back from a clinician standpoint. Jordan, you come to me and I'm your primary care and you really talk me into checking your hormones. And I'm like, okay, sure, I'll check them. But guess what? When I check your hormones, guess whose name I'm on it. Now I'm responsible for it. If I don't know what to do with it, I'm lost. I literally have my name attached to labs that I don't know what to do with. So now ignorance is bliss. And that's kind of what I say. In the world is if I never check them, I'm not responsible for them. Or even if you talk me into them, remember, all I got to make sure is if you're 250 to 1100 and you're normal. If you're 275, you're normal.
Oh God.
It's crazy, dude. It really is crazy. But see, the problem is there's no normal. What does that mean? Normal means nothing.
Thank God.
Normal means nothing.
I would walk into traffic if I was 275.
Dude, 275, you got
275 is dead.
Walking around dead.
And then they're told they're right. You know, and if you don't believe that shit, you know, they used to tell my grandfather salt was gonna kill him. You know,
Crazy.
like we grew up, salt was so salt's gonna kill you.
Salt,
dude.
This is this is a controlled substance. You make it.
Yeah,
your balls make it, and it's a controlled substance, dude. Isn't that crazy? A controlled substance. But then we'll give you an SSRI. They will give you anything outside of trying to replete natural hormones, bioidentical hormones, before really trying to get down to the bottom of why you feel the way you do. It's crazy. So I tell my guys, there's a big why. There's a crossroads. So when you come to me, let's say you're 32. Okay. Look, Kendrick, I'm tired. I can't lose weight. I go to the gym. I force myself to go to the gym. I work out. Guess what? I'm not getting the results. So now I'm frustrated. I don't want to go to the gym because I'm wasting my time. I go home. I have no drive to initiate sex with my old lady. I can't even get it up. If it does, it ain't staying up. You know what I mean? And I can't sleep because I got sleep disturbance because my brain never shuts down because I'm anxious. All these things come back to it. So now when I say, okay, let me check your testosterone level, and it's 320. Guess what?
Normal.
It's normal.
Fuck that shit.
That ain't the reason why.
Dude.
That's what you're going to be told versus the guy that comes in that's being replaced that has a testosterone of 1100 and experiences none of those things because his anabolic drive is so strong. He feels like a 20-year-old that has great energy, great drive, metabolism's cranking, libido's cranking, performance is cranking. That's why I hate these hymns and these shits that you see on the commercials. They want to send you Viagra and Cialis and SSRIs, but here's the thing. They're not fixing the problem.
Right.
Erectile dysfunction is a side effect.
On every commercial I ever hear.
Yeah, of course. I mean, not to be too vulgar, but you know what? Your dick didn't just magically say, I'm done working. It's told what to do. So there's usually three things. One, hormonal problem. Two, circulation, whether it be a vascular problem, heart disease, or diabetes that have really torn the vascular system up down there. Or three, it's a side effect from a medication. That's what happens from a lot of the SSRIs and depression medicines.
Yeah.
They're a side effect. They suppress libido and have erectile problems. So what are they doing? They're feeding you medications without fixing the problem.
But my big problem too is the way they market them too. It's kind of like it's a rainy day. There's some sunflowers.
Oh, yes.
I was on Zoloft, and I remember one time my buddy was bleeding. I was probably 15 when I got on Zoloft. 14. I was on Ritalin since I was 4 or 5, and then Zoloft came in at early teens.
Yeah,
I remember my buddy Eric Bird, shout out miss you, bud, but I remember him getting a big cut, a slash, and I was like, that looks pretty cool. And I was like, and I was in my winter. I told Mom, I was like, not stressed about it. I was like, oh, that was pretty neat. But that was like a situation where like it looked pretty cool that my buddy's arm is cut open, blood's pouring all down the arm, and I didn't even hesitate to like try to hold my hand pressure.
Nothing.
Yeah, and he's like, what are you doing? I'm like,
it's a loss.
It does something. So when you take SSRIs,
it's a loss.
It's kind of like, oh, that's cool. You ran through a window.
You lose that.
I missed the window.
It's almost kind of like a emotional, almost like a blank. Like you lose that emotional side of it, and what ends up happening is same thing that women go through when they experience perimenopause and menopause. Estrogen tanks.
Put Tanya Harding on Zoloft.
Of course. Well, that was after she had unclubbed somebody's legs down. I don't know if that was Zoloft driven, but
it's bad. I've been on antidepressants. I got off. I was there only for 3 years.
They're crazy. But here, the bad thing is antidepressants. That's the first line offense versus trying to optimize bioidentical hormones.
Feel better from
the hormones before you add something that's going to disrupt the brain function. It's just a poor understanding, man. It's like, really, it's not even like, for me, it's like, how do you not do the appropriate thing? I'm not a genius. I just stay up with theory and I know how to manipulate hormones.
They demonize steroids for 20 years. All right. But here's an idea that you can recreate things that your body naturally produces. Yeah, synthetic. And you're like, well, that ain't right. But it's totally okay to take some mind-altering fucking opioid.
There you go.
To make you just think a certain way.
Now let me
and forget about the beginning.
That's
what got you there. Yeah.
On that note, think about the term steroids. Okay, I already told you that estrogen is a steroid.
Yeah.
Insulin is a steroid. Your cholesterol is a steroid. It's a bad term. It's a stigmatic term that now has been attached to testosterone. So now when people talk about testosterone, they have a negative idea, condensation about it. I mean, it's like, oh man, you're on steroids. It's like, yeah, no, bro, I'm on testosterone. I feel great. I feel like I'm 20 again. It's not. I'm trying to, and what I do now is not only just on the clinic, and I don't even know how far we're getting into this. I mean, I literally started a telehealth company a year ago because I realized how much of a gap this was, not only just here on the coast, nationwide. This is everybody's thinking. So I literally go around and I try to promote hormone replacement therapy for this very reason. So here's what I think about. When I talk about, first thing that comes to your mind when I say fentanyl. Think about fentanyl. What do you hear about fentanyl nowadays?
Cocaine.
It's terrible. It's killing everybody, right? Fentanyl. Everyone's dying from fentanyl overdose. Well, what about the millions of people, cancer patients that were given fentanyl that had 80 to 90% of pain relief because it was prescribed correctly, it was managed correctly, and now you got the knuckleheads that are picking fentanyl up wherever they're getting it. I don't know, the cartel or across the border or Europe or wherever they're getting it, and they're chewing on it, they're dying. Now you've put this negative connotation on this medicine that was really good.
It's all about marketing.
It's about marketing.
It's all marketing.
It's all marketing. Whether you talk about, like you said, SSRIs, Viagra,
but always a sunflower. Like there's always some kind of big bed of flowers or somebody's happy.
Oh, dude, just look at what's the one where you got herpes. You know, it's like, oh, they're terrible. They're like sad that they got herpes, and now they're.
I just talked about this other day.
Now they take Valtrex, and now they're like running. They're hiking.
Bro,
and
when we were growing up,
again, you know, it's like it's marketing. It's marketing. It's like
when we grew up, it was like you had a fever blister. Now it's herpes simplex 1. I'm like, that sounds fucking terrible.
You got herpes, bro. No, it's the crazy thing. It's all.
If you got anything on your lips, herpes.
It's marketing. It's like you got the person that doesn't want to get out of bed because they got herpes.
Also the actor betrayal.
Oh, it's the betrayal. It's like they're sad, and then you give them herpes. Yeah, you give them Valtrex, and now they're out. They're climbing
diarrhea, bloated, or whatever. The whole list.
They're out like hiking and bowling now. Like they didn't like life. before they had herpes, and now it's like you still got herpes, bro. It just ain't active.
That's called preying on people too. That's why I hate that type of marketing, because
it sucks.
There's people that don't really understand that.
It's trickery.
Yeah, and they're like,
well, you're taking advantage of people.
Yeah, I gotta get on that, and I can be the best.
Mm-hmm. You're taking advantage of people's ignorance.
Yeah,
and ignorance not meaning like you're being stupid.
Like
it's
like
you don't know.
But the ignorance is even worse in the medical field. I'm talking about MDs.
That was crazy. Okay, so here's a perfect
on personal
example.
level. There's some MDs that ain't much older than me that did not know about hormone therapy, and it's insane. Yeah,
I know.
Yeah, and you know, I had to educate somebody who went to school for 20 years. I don't know, but I mean, I'm just saying, like, dude,
it's because you're in legitimately. I feel bad. It's a two-edged sword, man. You know what? I was at a conference. I was in a regenerative medicine conference in San Antonio this past weekend. And after the conference was over, I asked a lot of advanced questions because I was kind of like jamming up the presentation guy, because I do it also. You know, I want to get him from an experience standpoint. So this guy comes in after the presentation. We're out and we're by a little poolside bar, and then I grab a whiskey, and he comes out and he's like, "Hey man, you seem like you know what you're talking about." I'm like, I said, "Yeah, I've been doing it for a while." He said, "Look, I'm an OBGYN." He said, "I realized that this is not the route that I wanted to go in productivity-based medicine, where literally I'm seeing 60 to 80 people a day and have 3 minutes with each patient where I can't even get to understand them enough to even try to help them." He said, "This is what I want to do." And he said, "I can tell that you know what you're talking about." He said, "Let me tell you something. I already know what he's talking. I already know where he's going." He said, "We didn't learn about hormone replacement in medical school." I said, "Yeah, I know that. And you know what the problem is? You're the same people that the first line of defense is for all of your women from 15, 12. I don't even know when they start going to see a gynecologist. Young.
I think period.
It's a young.
Kind of the gig.
Young, bro. They're starting these girls on synthetic hormones at such a young age, and they're talking about why breast cancer and ovarian cancer and all this stuff is spreading like wildfire, because they're exposed to these synthetic progestins, which is not the bioidentical version. And dude, we can get so savvy into this shit, man. It literally talks about a lot of interchangeable words in the new technology where they talk about progestins and progesterone. Dude, these girls are exposed to it for decades. And now you got these young girls coming up with breast cancer and ovarian cancer and cervical cancer. It's crazy. And the guy told me, he said, we never learned this in medical school. And I am a gynecologist.
That's fucking terrible.
He's in a basic course that I blazed through a long time ago. And I usually present, and I'm there just for continuing education because that's what I do. I want to know about the latest and greatest of anything. If you got another resource, great, bro, I'm there. And he's like, I don't know anything. He said, they're talking about stuff that I've never even heard about. It's crazy. That's where we are, bro. That's where we are right now. Regenerative medicine is the entire different approach of taking where you are in life and improving quality of life.
Quality of life.
Quality of life. That's what it comes down.
They like that term.
You want to be 85? You want to be 85 and be crippled and do this? No, that's not living.
When are we going to get an updated blood panel?
Dude, it depends on who you go to. On my blood panel, I'm glad you bring that up. You go to your primary care, they usually tack about 15 to 20 markers. That's about your standard. Mm-hmm. You know, they're looking at your electrolytes and kidney and liver and
I want to get into like men's estrogen because that's a big one.
Dude, mine is usually about 55 markers that I check.
Yeah.
Because it's all estrogen. It's estrogen.
But that would be over, right? But that would be over.
I check estrogen. Estradiol is more specific for men on E2. Man, there's multiple different estrogens, but you ask a clinician, a primary about estrogen, they don't know what the hell you're talking about.
They crash that shit. Yeah.
Dude, they don't know what you're talking about.
All the benefits of testosterone and just
they have no idea. So when I check all these markers, it's because I'm trying to get to the bottom of making your machine that much better.
Yeah.
You can have a brand new car, but guess what? If I take your car and I take the headers off and I put better headers on.
Yeah.
And I take your throttle body off, I put a better throttle body on it. It's all about bettering that performance. And the performance, I'm not even just talking about bodybuilding. People think about testosterone as you got to be strong, you got to be in the gym. Bro, I'm talking about quality of life. I'm talking about cognitive. I'm talking about cognitive stability, sex drive, metabolism, recovery, sleep, all these things, man. It's crazy. It's crazy how much better I can literally take your body and manipulate it and make it so much better.
Is there any way I could have a consult right now?
Yes, let's do it.
I took this blood work about 3 weeks ago.
Yeah.
Oh, we doing it here? Okay.
Yeah.
Okay.
So
now was this fasting? No, I like it, man. 42.
Fasted.
So this was fasted. So first thing that jumps out to me, a fasting person like yourself, because I know you, with a glucose of 101. That's high.
That's one over the average.
Yeah, but a body with glucose over 84. See, this is what I'm talking about. This is where it gets really deep, where anything over 84 starts degrading the insulin receptor sites. Now you're starting to get into the parts of insulin resistance and predisposition to diabetes, things like that.
I do have to say that I drink every night, and I drink that night.
That's okay.
But I was fasted.
You know why that's not a contributing factor
midnight.
here? Because the first thing I think about when you think about drinking alcohol, where does it metabolize? Your liver, right? Your liver enzymes are perfect.
Okay.
This is not liver related. So the first thing I think about is your glucose. The next thing I'm looking at is whether or not you have insulin resistance. Because when I see that the sugar, think about sugar. Can I do this?
Yeah.
It's probably going to look weird. All right. I'm going to do that. I got that. All right. Let me perk it up. Let me perk it up a little bit more.
Hold it for me.
Hold his mic. Yeah.
Hold my mic. No.
Yeah.
All right. So look. So insulin, okay? Sugar, insulin.
Mm-hmm.
Sugar cannot get into the cell to metabolize for energy without insulin. Okay. So now when you talk about insulin resistance, if the sugar cannot get into the cell, the sugar stays in the vascular stream, which is what they're checking here. So now what I have to determine, if I'm looking at you and if I didn't know who you are, I'm like, oh, wow, this glucose is too high. Now I got to figure out, one is, was he fasting? Two, does he have insulin resistance? And three, does he have cortisol problems? Because when you have high cortisol, it interrupts insulin metabolization. So now you're predisposed, regardless of how great you look. People will look at you and say, dude, I want to look like Paige. Bro, from what I can tell from this pretty skimpy workup, which is
it's LabCorp.
Skimpy.
Yeah.
It doesn't have an A1C.
That was their top panel.
Yeah, that's sad because that's
their top panel.
So this is their top panel.
It has no insulin, has no cortisol, has no estradiol.
Okay, you don't have estradiol?
Nope. Well, you're on testosterone. So guess what testosterone does? So when testosterone, there's a process called aromatization. Yep. When testosterone breaks down, it creates testosterone and DHT. We were talking about hair earlier, right? I got some badass hair. Testosterone breaks down into DHT and estrogen. DHT attaches to hair follicles and kills them in certain people. Not everybody.
It also makes you break out. DHT.
It can also make you break out.
Yeah,
high levels of testosterone and DHT. So DHT normally attaches hair follicles in the prostate.
Yeah.
Testosterone can clog some of the the sebaceous glands in the skin and cause a little bit more oil breakup. But you're talking about this
estradiol's not on there.
No, it's not on here.
It would be under the testosterone.
No, it's not on here, bro. Literally, you got no estradiol on here. So now I do know that your prostate looks good, your TSH is normal, your cholesterol not great.
Carnivore diet.
But I've been on carnivore for over 2 years.
That's going to contribute to your LDL being high. But your liver looks great, your kidneys look great, but your glucose, look at you, bro. You literally are close to being considered a pre-diabetic based on that glucose.
1 point over?
Yep. Because
but maybe that average is like the other averages.
Here's the thing, normal. Your normal for you should be under 84. 1 point under, if that's like saying, look, hypertension, high blood pressure is 140 over 90. If I'm 139 over 90, I'm only 1 point there, bro. I'm not hypertension.
But I'm going with the idea that testosterone average is 200 to 11.
I ain't even look at your testosterone. I'm thinking
it's
about
900
everything
something.
else.
I'm on Propionate, 250 milligrams a week.
You know, the other problem is that is dude, it can get so savvy. So total testosterone doesn't even tell me how much you can use. Total testosterone just tells me how much is free floating in the body.
Who does your blood work?
I do it.
What, your company?
I have a phlebotomist in my office.
But y'all process it.
Oh, through AEL.
ADL.
On Seaway.
AEL.
The reason why is because it's cheaper than LabCorp. You go to LabCorp. What I did was I took the best way of getting people that don't have insurance to come in and say, hey, I don't have insurance. It would cost me less to pay.
How about now?
All right. How about now, y'all?
Well, I don't see video. Check.
It's about to pop up.
Hello?
Check.
There we go. Yeah. All right. Cool.
I'm
Just
good.
got to
This is
refresh.
like, that's
Yeah.
your world?
Oh, we got audio now.
Oh, yeah?
So yes, this is my world.
Okay,
Kendrick,
yeah, shit fouled up.
You're on a fucking monologue. Please
Yeah.
continue with that monologue.
Kendrick, you're getting a lot of love though from the viewers. Apparently, you got
Hell yeah.
quite a few of your regular clients
Sweet,
in
good,
here. So
good.
yeah,
Yeah,
good.
they're
Dude,
all saying they're all singing your praise
I
over here right
thrive.
now. Yeah.
I literally thrive off of like hearing people say, dude, thank you. You know what I mean? Like I literally don't do it for margins. That's why I utilize insurance. Most clinics that are in hormone replacement and regenerative medicine are all cash pay because they market way up and they have large margins. That's not what I'm in it for. I like the idea of just like making I like making something better. It's crazy. It's like, wow, this performance, dude. It's like, I love it.
You're
So,
changing
you know
people's
that.
lives, bro.
I'm changing
Yeah.
people's lives,
You know?
man. It's
Yeah.
like, dude, if you
You
can
are.
sit there and tell me like, dude, I've been, dragging ass for a decade and I went through, I literally had a guy, I don't even know where we were. We were talking about your labs. We want to circle back around that.
No, we don't.
So-
got- well,
so
These
anyway-
are garbage labs.
Yeah. So
Shout out to
essentially-
LabCorp.
So
Don't go there.
$200 go to
So essentially, yeah, you
Lying
need.
pieces of shit.
I'm calling my liaison tomorrow, bro. You need to reimburse my guy like half, bro, 50%. Yeah, no, this is I mean, this is not bad stuff, but it's just like you've been overcharged for a minimal amount of workup.
Yeah,
I mean, that's
well,
the problem
I've seen
is
it.
when the markers do not indicate something that I can say, look, dude, this gives me enough information to make a logical recommendation. It ain't there. And when testosterone is replaced, men accumulate the majority of their testosterone through a metabolization of testosterone, and it creates estrogen. Well, if they're just checking testosterone, they're not checking estrogen. Estradiol, as it builds up in the man's system, it creates fat retention. It creates
Can't believe they have fucking
fatigue.
estrogen on there.
It's not on
I
there.
pay for fucking
Dude,
hormones.
I
So he
literally,
does daily injections
dude, I look at labs
Other
like
every day.
every other.
other day, which is you're on a propionate.
Propionate, yeah.
Okay, so that's
250
appropriate.
milligrams a week, and I'm so
That's appropriate.
one day after injection, I'm at 926.
Great. So a propionate is a fast-acting ester. So the
Yeah.
way that you look at medicine, regardless if we're talking about testosterone or lisinopril, a blood pressure medicine, whether or not you have to take a medication once a day, 3 times a day, once a week, it's the half-life of the medicine. How long does it break down over a period of time?
Right.
Propionate, very fast-acting ester. Okay, so you have to pin it every other day. But the good thing about that is you don't have as much aromatization, which creates more estrogen, which creates body fat. So it's a very gentle balance. And when I, again, come from an anabolic world with bodybuilding and exposure to all those different esters and how to manipulate testosterone, I think it's a great testosterone ester. The problem is most people don't want to pin every other day. And that's okay.
Yeah.
There's a pain in the ass. All right.
But who invented the blood pressure pill? Like how did they clear that and it became like
Same. So what happened is all medications originate somewhere along the lines of trying to get the best benefit out of a lack of negative side effects. So the way that they find that blood pressure responds, whether it be in the kidneys, whether it be in the vessels, whether it be from too much volume, from heart failure. Okay, think about plumbing. That's essentially all we are. Bunch of plumbing. Is that right? Plumbing?
Yeah, plumbing.
Plumber?
Plumbing. I think
I
it's
like
same.
plum.
I like plums.
No,
I
but I
like,
mean, so you're pretty much. I mean, we're mechanical.
Yeah.
yes, we're mechanical. All right, so plums, I think of
Bunch
food,
of tubes.
So plumbing. All right. So think about too much fluid. All right. Think about your water hose. Too much fluid. It's putting more pressure on whatever's behind it. Guess what's behind it? Your heart. So the more pressure that your heart has to push forward against a vascular constriction, that's what blood pressure is. That's why high blood pressure is not good, because that is restricted vessels that the heart has to push that much harder towards. So when you minimize these things, now you're saving the heart. But how you do that? The cool thing is there's all these different medicines that allow you to do that. And when you're savvy enough to use medicines correctly, like I think about Cialis. My guys love Cialis.
Daily Cialis, dog.
My guy loved Daily Cialis. The reason why
Yeah.
people think, bro, I don't have ED. I was like, I don't care. Cialis was originally made as a vascular dilator, actually for pulmonary hypertension. It was made to increase circulatory flow through the lungs for people that have pulmonary hypertension. So the problem is when they were pumping these trials through and they're seeing that, dude, all these guys are getting rocked up secondary to their medications. They said, well, hell, what are we doing? We're opening up the vessels as a vasodilator, and now we're allowing more circulation wherever it is. In this case, downstairs. Remember earlier I said ED is a side effect. If it's not hormonal and it's not medication, circulatory. So now you've basically opened up the vessels, pumped more blood there, and now from a performance standpoint, guess what? When you go to the gym, more blood to the muscles brings oxygen carrying capacity to the muscles. So you get a better pump. It's all about utilizing these medications to be a badass. That's the way I think about it. It's not about just trying to make sure you don't have high blood pressure, that you don't have heart attack next month. It's about getting your body to perform at its best so you have quality of life and longevity. Boom. That's it. That's the way I think about it.
Dude, how many people thought you were crazy when you first started doing this?
A lot.
Yeah, I'm just me going
Stay ahead of the
straight
curve,
podcast
man.
when you got this
A lot.
Yeah, that's yeah.
But I'm not even talking about something that's new.
No.
I mean, you can watch again the same guy.
Here.
I don't
Well, these
obviously
same
have
doctors that are looking at their numbers are calling him an idiot.
they're an idiot because here's the thing.
Yeah.
You talk about the same guys that have learned that 30 years ago. These are the same guys that are
But all these
practicing
guys are healthier,
urology.
right?
Stop. Ray.
These are urologists.
He went away from the book.
Well, because the book's wrong.
Exactly.
That's the problem. The book is old.
Yeah.
So you got Joe Blow, doctor, whoever that's practicing medicine 40 years ago, not keeping up with continuing education. And us, as literally one of the top leading advancements in medicine, you know what? We are the top 3 in the leading medical advancement of in the developed countries. Guess who's the unhealthiest? United States.
Yep.
Guess who has the highest level of obesity? United States. Guess who has the highest number of gym facilities per country per capita? United States. It's like, dude, everyone's trying to capitalize on it, but somebody's so sloppy.
Do you think it's a big part of it? Like you see these people on social media now, face filters, thinning out. If you look at the image, they're more into now a digital image versus
aesthetics. Yep.
Yeah, very much so. It's like, look at me.
Mm.
Is that like that's a real impact? Because now you can actually, you can put a filter in and be 30 pounds thinner, right?
Also, how do you feel about Ozempic?
Ozempic?
I'm glad you brought that up.
Ozempic. I don't know. I've never taken it.
I'm glad you brought it up.
Yeah,
You
what's
know why?
that?
Yeah.
It's great medicine.
Okay.
It's a great medicine if you use it correctly. It's a peptide,
All right.
and we could talk about peptides,
You-
bro. I talked about
do
that
you like
earlier.
peptides?
I talked
You
about
fuck with
it.
them? Do you prescribe it?
Yeah,
Hell yeah.
but here's why. I'm gonna tell you why I'm different. I'm not Hims. I'm not gonna prescribe you Ozempic. We're trying to figure out why you can't lose weight in the first place. If you're a slob because you have behavioral problems, you can't stay out the pantry, and you can't not eat sweets. You can't not eat sweets. I don't know what I was going to say, but I like sweets. You can't eat sweets. You can't continue to stay in this impulsive amount of eating pattern versus the fact that it was originally utilized for type 2 diabetics. It decreases insulin resistance. It slows gastric emptying. So now you get full quicker.
So that I was reading up a little bit on that.
It's a
where
great medicine.
People were eating, if you're eating like junk food and taking it, like you can't shit.
It
ruins your whole.
It shuts you down.
Yeah, you can't. You build your stool.
It shuts you down, so it slows gastric emptying. So now your portion size is down. Your insulin has now increased, so now you metabolize sugars better, and it even turns off some of these dopamine receptors in the brain for people that like to drink. They're actually studying it right now for alcoholism and people that have impulsive sweet eating. They just love sweets. They got this food craving in the brain. Here's the problem. You put a person on this medication, they stop eating. They're not taking in calories. You're not only burning fat, you're burning muscle.
Right.
It's a misconception. People say this thing's eating up muscle. No, your body needs to eat calories. And if you don't give it sufficient amount of calories, it's going to eat whatever the hell you got, including muscle. So do I think it's a good medicine? Yes, if it's used appropriately. I use it temporarily if I'm trying to diagnose another metabolic problem. If I use it and say, look, you say, Jordan, look, bro, or I'm talking, Jordan, you got to lose 15 pounds, 20 pounds. Dude, you got this impulsive eating thing. You can't stay out the pantry. I'm gonna run some blood work. Looks like your thyroid's okay. It looks like your cortisol's okay. Testosterone's a little bit low, okay, which is the second most metabolic hormone in your body. How about we implement some testosterone replacement therapy while I'm utilizing this medicine to facilitate some of that weight loss? So guess what? When I take that medicine away, you don't blow right back up. If you don't fix the underlying problem, same thing as Hims, okay? All they're doing is just throwing you medicine just to keep you on the hook. You got to fix the underlying problem. We're a boat guy. I mean, you boat. You go out in a boat and you got a hole in it. It's kind of like me walking up to you and say, hey, bro, here's a pail. Good luck. That's essentially what I did. I like to fix the hole. I'm a problem resolver. I want to fix the problem.
Makes sense.
So I approach that I use medicines how they're supposed to be. I don't look at them like, oh man, you just need a crutch. So what? You need help? Great, use it. If you need that crutch, you need help to say, look, I just got to turn off this food noise in my brain. People have it. It's real. People say, look, I'm not hungry, but I can't stay out the kitchen. I got this thing in my brain.
How many clients do you think you turn away when it comes to dealing with, you're like, you're trying to get on the right path and they just want to take your medicines or prescribe things and you're like, I can't do this.
It's tough. It's tough for me because I like to fix people. I like to help people. And sometimes people are just not susceptible to help. They want the easy fix. And I tell them, I'm like, sorry. I mean, I can only use it for so long until you have to fix this. You can't stay on this medicine forever. I use it as almost kind of like a jump off. You want to lose 15 pounds? Great. I'll use it while I'm trying to figure out why you couldn't lose the weight in the first place. If you're insulin resistant, cortisol's too high, testosterone's too low, estrogen's too high, thyroid's dysmetabolic. There's usually something that drives that. And that's what I like to manipulate. I like to fix things. I'm not just trying to give somebody a Band-Aid. I'm not that dude.
In that same concept, there's no magic medicine.
No, there's not.
Yeah, so my friends of mine will be like, well, yeah, you're on hormone therapy. I'm like, you still got to train.
Here's what I say.
I mean, like, if you could just inject and look incredible, every person with extra exposable income would look incredible.
My testosterone, when I optimize it, literally, I'm talking about mine. You want to know about mine? Yeah. My testosterone, I keep it about 1,100.
Okay.
My free testosterone is about 300. Guess what? That's the same as every 19 and 20-year-old that walks around. Are they all walking around jacked? No. You have to put in the work.
What do you weigh?
190.
How tall are you?
5'7".
Shit.
I'm obese.
Yeah, that's what
Come on.
Dude, the BMI.
Talking about the weight loss thing, man, I took health class in high school, and the one thing they didn't teach is macros.
Macros.
If more people knew how to read macros, just
macros
look on the back
health.
of a fucking bottle or anything, and you'll be disgusted. Like,
dude, it's so crazy. Are we still going?
Yeah.
Okay. So here's the thing when you talk about macros. Okay, a calorie. Everybody knows what a calorie is, right?
Yeah.
You know what
It used to be a calorie count because I wasn't a dietary clinician.
it's calorie count, right?
Yeah, it's
But
a
guess
calorie
what?
count. They turned it into, in the new generation, calls it macros.
Macros. But guess what? You're going to burn a calorie different than I'm going to burn a calorie. My metabolism is different. So just because you intake 2,500 calories and expenditure wise, you're 3,000 calories, that doesn't mean that it took the same amount of effort for you to burn that. So people get caught up on this. I am very metabolic because I don't have insulin resistance. My cortisol is in check. My thyroid's in check. My testosterone is where it should be. My estrogen is where it should be. I sleep appropriately. My growth hormone is where it should be. I take peptides at night to help me sleep and increase my growth hormone. I'm going to burn that calorie 5 times quicker than the guy that does not have any of that going for him. Right? So I get the benefit out of drinking bourbon, and I just ate, 15 smoked wings across the street, and I eat French fries. People think that, oh man, you look great. What do you do? I'm like, dude, I eat what I want, but I also exercise 4 to 5 times a week. My body is as primed up as it could be. Dude, it's like a Ferrari, bro. Put shitty gas in a Ferrari. Yeah. You think it's going to run good? No, you have to feed it appropriately. You have to be running on all cylinders. And whenever everything is clicking, you're running on all cylinders. I guess I just look at things. I literally look at the body as something to make better. And that's the problem with other people. They're looking to normalize. I don't care about normal. I want you to live your best life. I want you to get up, be primed up for the day, go to the gym, get the results that you're supposed to. That's the big problem. On the January 1st, everybody knows there's going to be a huge influx of people at the gym.
Forever Young and Do What Makes You Happy, bro. That's a collab.
Dude,
coming soon.
Dude, I'm ready, bro. Whatever. I'm down. I'm down.
I know you fucking are,
I'm
dude.
here. I'm here. I'm literally down the road.
I loved you before you
You
took
knew
off
me
with this
way
shit.
before
Yeah,
this. I
and,
mean, back in Pastor Sheehan days. So
Yeah.
I mean,
So
I mean, again, the way that I think is just, dude, I want everybody to live their best life.
That's
and
it.
Once you understand that the body cannot be at its best without taking over some jobs that are going to fail.
unless you want to die at 45
Unless
like we
you
used to or something.
It's crazy,
Yeah,
right?
and so
It's
look,
crazy.
Yeah.
We are advanced as far out as we could ever have been, and yet you got the highest level of obesity ratings ever.
So that's,
Dude, we could live forever. We could not live forever. We could literally extend the amount of aging so much farther out, but as so many people are walking around lazy, eating trash.
well, they celebrate lazy.
They celebrate laziness.
The
it's
lazy
normal.
is like how they.
Guess what's normal?
No, this is how we are.
We're not normal. You're not normal anymore.
We work 7 days a week and we podcast twice.
Bro,
a week.
you're not normal anymore. When you look at, all right, next time you walk into Walmart, how many people look like you?
No,
Not many.
we're all on hormone therapy. Yeah.
No, what I'm saying is that's not, you are not average anymore. You know
We're
what's
not.
average? Obesity is now
Yes,
average.
yes.
Right.
That is now the average. So now when I feel comfortable in my setting because everybody around me is fat, I don't feel out of the ordinary. It's become acceptable to be overweight.
Just trying to figure out where that goes.
You're now the minority. You are the minority, not because you're race, because you're BMI.
Well,
Isn't that crazy?
in the same concept that my cousin brought up a good point. I think sex is kind of falling out. Truly,
Everything is.
Yeah, like I don't, there's not a physical attraction or like there used to be. Like
Desire. The desire, libido is directly affected by hormones.
Yeah. Well, all right. So now I'm gonna sound like a first world problem. I'm gonna talk logistics. Logistically, I got spoiled in the pandemic, and that's the reason why I'm still working with these companies in Florida and shit. So if you come to you and you get the blood work and stuff, does someone have to come to see you
Physically?
every 2 months?
No. Oh, so you're talking about like
you can
process?
mail it. You can email it to the door.
Like quick process. Okay, so say if anybody's interested, yeah, sure. You call my clinic, you pay a consultation fee. Okay,
Right,
$150.
Yeah.
$150.
Common.
And you get literally an in-depth if you can't determine that I'm not super in-depth consultation, I'm gonna ask you some weird shit, and I want to know about everything because it's subjective when compared to objective, because my data is going to be different than yours. I need to know how you experience your life compared to the numbers that I'm looking at. So $150 for the consultation. Lab work is covered through insurance if you have it. I'm one of the few clinics that allow that because, again, I'm not looking for big margins. Even in my telehealth company, same thing. I'm the only telehealth company that allows insurance because a lot of the telehealth companies utilize labs to mark up their margins for profit. I don't do that. Again, that's not my MO. So once you get your blood work back, I essentially formulate whatever protocol it is. I don't really know what it is because I don't have a blueprint. There is no blueprint. You don't come in and see me and say, oh, you're 35 and your testosterone's here and your estrogen's here. It's here. Like I have to talk to you as an individual. So I formulate that, whatever that regimen is, and I work on kind of like a membership where it includes your management and your your medications. So say for you, let's just say a general guy that's on testosterone replacement costs you about $150 a month.
Yeah. Oh,
so that's it. About the same amount that you're going to take your family to Outback.
You're not trying to take arms off. You're just trying to.
No, bro. I literally
totally
don't care about. I call myself the Planet Fitness of health.
Totally worth it.
Literally, I'm trying. I don't because that's not my MO. Bro, I
already
literally
know.
want to try to get as many people exposed to this
Yeah.
as possible.
Do I
Truthfully,
physically
it'll
have to be
save you
there?
money over the long run because all the money you'd spend on all these doctor
Dude,
visits
bullshit
Oh,
supplements.
God.
all day
Supplements
long.
and
Yeah.
vitamins that are not going to do anything
Right.
for you.
Yeah.
That's super cheap.
Yeah.
Dude, I had
Yeah.
people come in and literally bring a bag of vitamins. I said, look, you will pay for your membership just by throwing this in the trash.
Right.
And I will make you feel that much better.
Yeah.
All day you may. Oh my God, dude.
Me and him when I was
Me and
back
Kay
when I was
drank
competing.
that shit for 30 years. Rich Piana,
Rich
who
Piana.
died
Oh, dude.
from a heart
Hey,
attack.
look at Rich Piana.
I had
He's
fucking
dead,
like
right?
20
I mean, he was
supplements
safe.
in my bag.
He was safe.
Can we go back to-
He
can we
was
go back to marketing.
he was legit. I mean, he was
No,
natural.
we were drinking the all day you may. I'm showing them how much we spent on supplements.
I mean,
No, dude,
Bradley
he was
talking
the only
about.
honest guy back then that
Oh.
was talking about antibiotics, though.
But
I
I'll
mean,
give him
he was
that.
natural. He was all natural.
Well, that's
Yeah,
fine.
right.
All right, so I'm talking about creatine all day you may. We were spending $200-$300 a month.
All day. Bro, it's
That's
all
what I'm talking
marketing.
about with
Yeah.
supplements,
Look at
yeah.
your guys that are marketing. Look at the guys that are on TV. Your Gary Breckas, your Groggins, all these guys that are health guys, and they're out all they're doing is just promoting their own
Yeah, like-
products.
And have these beds. I mean, which I know they're probably good, but they're partnered
Dude, a
with.
supplement. Look, here's the thing. You go and take a supplement. You know when you need potassium? When your potassium is low.
Yeah.
You don't take fucking potassium for no reason. When you need magnesium? When your magnesium is low.
Hey, let
When
me-
you need vitamin B? When your vitamin B is low. When your B6 or B1 or B12 is low. People take so many supplements thinking it's going to fix their underlying problem. It's a sedative. A magnesium is a sedative. So it is good for some instances, but you got so many people blazing through medicine thinking they're going to GNC.
I take vitamin D, though, daily.
Everyone needs vitamin D. But guess what? I never met somebody that only took vitamin D and felt great. No, because it's never going to fix your problems. Vitamin D is just something that your body needs to be exposed to. And either there's an absorption problem or you sit inside and you're like a weird hermit or something.
Actually, your body synthesizes its own vitamin D. You just
Correct.
got to be sitting in the sun
It
for your
has
body
to-
to create
you
it
have to
itself.
have
Yeah.
exposure.
So you're good. Good.
Yeah. Yeah. Oh, so you're indoors all day.
Yeah, I'm on indoors all
Yeah.
day, and then I'm sleeping during the day.
Of course.
So I take it, and mine is prescription.
Yeah.
So I'm not taking
It's
it
prescribed.
Yeah.
So here's the
Mine
thing.
is prescription.
It's because your vitamin D was probably already noted to be low. But here's what I tell everybody. When's the last time you took vitamin D and you felt great? All your symptoms went away.
No, it doesn't take. Your body adjusts to it.
Exactly, because vitamin D is usually just a very small component of what's wrong. Crazy.
Allergy
Yeah.
too. Allergy too. When you take it,
Guess
it doesn't
what?
work until like 10 days from now.
Guess what?
Did they hear?
What?
Are we on board?
Yeah.
How old are you?
Yeah, they can hear.
Ask him.
No, I got to know. How old are you?
Everybody guess. 32.
Just good.
No, it's-
This is all just for medicinal purposes. I have the 35.
I'll take it. You just have to remember.
What? You lying? You're
Good.
50
Oh,
plus?
sound good though?
Yeah.
No shit.
Yeah,
Okay,
yeah,
well,
yeah.
good for you.
Everybody said we're good.
Well, no, you
Yeah.
look great.
52.
Well, here's the cool thing, right? You're 53, okay, based on what you just told me. Have you had
One.
surgery, meaning hysterectomy or anything? Have you
Natural.
have you already went through menopause?
I don't know.
There you go. Guess what? As good as you look for your age, right? As good as it, I don't know if you may not even be on camera. As good as you look, and as healthy as you are, and as clean as your skin looks, and as good as your hair looks,
Hyaluronic acid.
guess what?
And
I don't care.
like-
You can take everything.
No,
Guess
I
what?
know, and I-
Your ovaries are going to fail. I don't care how healthy you are. A woman will never. A woman, well, I'm just telling you, a woman will never not go through menopause. So the reproductive system is designed to fail. I don't care how fit you are, how healthy you are, how good you look, how old you are. The reproductive system is going to fail. Every woman knows that.
Oh.
Everyone's different. I mean, I have women that have made it to 55, and I've seen women that have been through menopause at 38. But the thing is every woman knows that it's going to happen one day.
Right.
Every man should understand the same thing. They're going to go through a similar called andropause. Same thing.
What
Low
does that mean?
testosterone.
We can't.
Low testosterone. Nope.
Well-
It just means low testosterone. A man will always be reproductive via sperm.
Okay.
So you have enough sperm to always be reproductive, but the amount of testosterone that the body makes with age declines. And that's where you start having symptoms. So the cool thing is, as I tell people, I say, look, when you come in and see me, say you're 32, well, you're going to even say early, 28. I got a lot of people come in and even see me earlier, like I talked about.
When should they start coming to see you?
Early is better. Because here's the thing.
Sounds like they need to be coming in like 25 to 30.
Dude, check this out. All right. So let's say this. Let's say you're 32 and your testosterone 370. Well, what was it 15 years ago? Was it 1400? So now what you've done is now you're down to 30% of what you were optimal when you were 20. I don't know that. It's a variable that I can never account for. And that's the problem with hormones. There is no normal. When you don't know the X variable, I don't know where you should have been to make your body function at its best. So when you come in at 420 and you say, look, man, I'm tired. My libido sucks. My sleep sucks. My metabolism sucks. My sexual performance sucks. Then I have to assume that once I rule out everything else, that your body was probably used to being 13, 14, 1500. And now your body is experiencing the symptoms related to low testosterone, even at what you consider normal. Same thing with diabetics. I worked in the medicine field for a long time. So you get a diabetic that's used to having sugars in the 250, 300, 350 range. If you give them insulin and drive their sugar down to what's normal, they feel symptomatic. They're going to pass out. They're diaphoretic. They can't speak because their body is not used to that. So same thing with testosterone. Same thing with estrogen for women. I never know what their estradiol should be. So when they start experiencing these things, you just have to be sensitive to understanding that everyone's going to be different.
Right.
And it's an easy concept for me because I've been doing it for so long, but nobody else seems to really grasp that. They're so fixated on trying to be between, these numbers, because I don't want to deal with you. I don't really want to waste my time trying to figure you out.
So if our viewers here want to get in touch with you, if they want to start on a program, where would they start? Do they start with the website? Do they start with the phone number?
Easy.
Look into this camera over here. Tell our guests tonight how they should get in touch with you.
Easiest thing. So yeah, I spent a lot of money. I got a great.
Yeah. Hold on. Jordan has one other question before. Then we'll do that.
I got a great website. FY Forever Young Gulf Coast.
Hold on, Kendrick. I want to hit you on this one question.
Oh yeah, go ahead.
Yeah,
because this is like, and this is what Anthony was like. Talk so highly of you, and Cade has, and you pushing a whole different style.
We can do another one. I can talk about this for hours.
But they were talking about like you're breaking kind of that barrier. I just was asking the question of like when you first started Forever Young, how long did it take you to actually build a clientele business? Because you put money out there to have your own store. I know there's like these boys' investment and how they do stuff. It's not free. How long did it take you to like start seeing regular customers?
The good thing about it was because I already had a pretty strong footprint. I grew up in Gulfport. I worked at Memorial for 15 years. So I worked out at all the local gyms. So I kind of had a already pretty good following. So that helped me out. I mean, really, dude, I didn't get investments, dude. I put my own money in it. I had a badass 1970 Charger that I sold.
I remember that.
You remember that? Dude, I had a gnarly 70 Charger, bro, 496 stroker. I mean, that was kind of my thing. And I sold it because, it was like I knew I wanted to fund what I was more I was more passionate about. And that was what kind of helped me get my grounds running.
Yeah, so I want to know. And so you had to like say
you have to sacrifice, man. Really, it's all about sacrifice. It was funny. I was down the road. I was eating before this, and someone asked me. She said, or someone was sitting at the bar and said, "Hey, you're Kendrick McCarty?" I said, "Yeah." I said, "I'm actually about to go down to Jordan's to go do a podcast." She said, "Oh, I send patients to you." I'm saying, "Oh, awesome, thank you, I appreciate that." And she said, "Well, when did you decide to take the jump and really start your own clinic?" I said, nobody ever decides to do that. It's scary. You know what I mean? It's scary.
Yeah.
You decided to do it.
Yeah, boy.
Dude, I literally, when you go from, when you're established.
You're like any other entrepreneur, man. You just take that leap of faith and you fucking
I didn't do anything special.
No.
All I did was say, you know what? I feel passionate about this. I literally left Memorial after 15 years of work, had a 6-figure salary. I didn't have to worry about it. That's not what I enjoyed. I enjoyed hormones and performance and really getting people to do
You're
their
truly
best
changing
quality,
lives.
truly changing lives. So it was scary, bro. I took the jump. I got my ass kicked. I was working in orthopedics half-time, like part-time. And I literally I would get off of work and go home and I'm calling people. I literally I was renting a room, leasing a room in another building. This was my phone. I didn't have a secretary. I didn't have staff. I was answering my own phone calls. I was doing my own consults. I'm drawing my own blood, spinning my own blood, writing lab orders because I had no direction. I had to figure it out. But once you understand that you have a drive and you have that end goal of being successful, or you have a frame of mind that says, you know what, there is no failure. I got my ass kicked. Bro, I'm literally, if you would have saw me 4 years ago and you saw me in my little rented room, we would have had our consult. I would have got you from the lobby. Nobody ever does that. You have staff that do. I literally would walk out to the lobby, come and get you, do my consult, draw your blood, spin it, write the lab order. And I literally did everything. When your lab results came back, it may have been 3 days later when I got off work, and I'm calling you at 9 o'clock at night from my personal cell phone.
Yeah, dude.
Dude,
That's true. That's true. That's true grind, dog.
Dude, I still have
right now.
That's the
still
shit.
have people call me on
That's
my
the
personal
shit.
cell phone because they were my early clients that I would text them at 9:30. Hey, sorry to bother you. Do you have a minute that I can go over your lab results? That was when I was doing my lab results, and I'm charting at midnight. Dude, it's not.
That's the question I've been hitting on now
Bruh.
because I love pulling
That's
stuff like this
sick.
out.
Dude, I mean,
It makes sense.
We could again. I could
Oh,
start.
you're coming back on
Dude,
part
we
two.
could
coming
start
back
for the
on.
body.
Have
Dude, we
to.
ain't even.
I'm-
touched
You're
it.
coming back
digging.
on.
Yeah,
We ain't
I'm
even
digging next time.
scratching
I'm
the
digging.
surface,
Yeah.
bro. We're talking. We could split it between business and peptides and hormone and men and women, bro. I could talk about this shit for days.
Yeah.
But from a business aspect, you can't be comfortable. Once
Nah.
you're comfortable, you're
I'm
never going
never
to take it.
comfortable. I'm
Right.
never
Never.
Well, that's why
Never.
people don't thrive because they get scared. They thrive in being comfortable.
Right.
They
Yeah.
can't get uncomfortable.
So this is a saying I always say to myself. This is how I just live. I don't do anything that doesn't make me uncomfortable.
It should always be uncomfortable
I just do.
Always.
I have to live my life that way.
because you know why? You've put yourself in a position that nobody else wants to play in.
If it's complacent, I ain't doing that shit.
Nobody's complacent. Dude, I got a successful clinic. I don't have to go to my clinic
Dude,
anymore.
You built a brand.
I don't have to go there anymore. Not that I'm saying like I'm bragging. No, what I did, as soon as I was able to get it sustainable where I didn't have to be there, I realized that this was something that needed to be done nationwide. I started my telehealth business, and now I travel and I do stuff like this, and I do conferences and I speak to people because I think that this is not only a gap that I recognize here, this is literally nationwide. It's a problem.
And you're not going. And that's the funny thing is the way you charge. So like that's really cheap the way you charge for people.
$200.
That's awesome because there's a lot of. I'm not going to name a lot of names, but you're watching this, and
Oh,
it's
they're
all-
tagging their boyfriends.
It's all
Yeah.
fake. I mean, when
Crazy.
you can't be an entrepreneur or a motivational speaker if you don't believe in your product.
Dude,
Now,
it's
if you're
crazy.
trying to make a living off of selling a class, you're fucking weird. You better believe in that class you're selling, and you better put your heart into it.
And I'll say this, and I usually when I go to presentations, I talk about my telehealth business.
Bring that mic up just a little bit so we can.
I tell the same people that when I go and travel, all out of my expense on my other telehealth business, I don't pay myself. I've been working on it for 2 years. I've traveled. I go to conventions. I go to conferences. I talk to gym owners. I talk to health professionals. and I literally have not taken a salary in 2 years. Period. I pay my patient care specialist. I pay my social media guy. I pay my director. I take no money out of that.
I can believe that because I've done 3 years of insurance and didn't make any money out
You
of
can't.
Do you guys remember
I
what
literally-
Will Taylor said on the last
now,
pod?
luckily, I wouldn't have been able to do that had I not got Forever Young where I needed to be. It facilitated what I needed to do. Not that I was given that. I just told you I sold my 70 Charger. That was
You pay your
bad
people
bitch.
before you
man,
ever
come
get
on.
paid.
Dude, that
Gotcha.
so I had to sacrifice, and I put a lot of time and effort and money. I have no investors. I am my only provider. I have nothing overhead.
You're the
No
one
partners.
and only.
One and
You
only,
own
the
your own
same,
business.
both. I mean, I put all my money into it just
Fucking
because
brilliant.
I get it, bro. I get it.
That's amazing.
It's the future. It's going to be successful, and I'm glad that regenerative medicine is starting to hit the forefront, and I want to be on the front end of that. You know what I mean? I feel like I'm a good representative, and I understand it, and I don't try to take people's money. I'm not a money grabber, dude.
Yeah,
like a lot of these people.
we're doing a live show. I can feel your positive energy.
Dude, it's crazy.
I believe in vibing people.
It's vibe, dude. I
Yeah,
love
it's
it, bro. I
fucking
literally
awesome.
I travel, bro. I travel and do the same thing, and I don't pay myself. I don't make money. Crazy. I'd love to. One day I will. Now
Building
once
the
my
business.
telehealth
What
business,
were we talking about earlier?
Kendrick McCarty, the future of telemedicine.
the telemed,
talking
bro.
about earlier,
Dude,
Yeah.
he
I
is
wanna
the
be-
man.
I want to be an originator. One day I want to be, not that's what I want to look back and be a guy. I want to be just somebody that says, look, dude, this guy changed my life.
Dude, you've already done it,
Hey,
man. You're already
The
there.
face of holistic.
Keep doing what you're
medicine.
the
doing,
face
brother.
of holistic medicine.
Let's go,
So
That's
look,
it.
with all the travels, all the research,
Yeah.
all the hard work. There was a quote that I heard that in 50 years, death will be obsolete.
For the
Did you
rich.
say that?
I didn't say that, but there are studies, but that's the whole point.
No, but go ahead.
Medicine is always advancing. Once
Yeah.
you stop advancing, you get complacent.
Yeah.
Jordan said that. Nobody likes complacency. I don't have to go to these continuing education. Most of them don't know more than I do, but I go because I always want to be on the forefront. I never want to miss something that's happening. I never want to be somebody that doesn't know the latest and greatest out there, because I don't want you to sideline me and say, I didn't know. I don't want to be the guy sitting there and say, I don't know what that is. I want to know about everything, because now that's what I consider my specialty. I thrive in that. So you're never going to be able to jam me up. And that's why people say, well, how do you feel comfortable prescribing all these medications that may not be within regulation? Like, put me on the board. I would love to put me somewhere. You tell me that someone is going to give me some comparable argument as to why I prescribed out of what I thought was necessary. Because all I'm going to do is say, all the data that is currently being looked at right now and being utilized in the clinician standpoint is all outdated. They're all doing just stuff to just make sure you don't die tomorrow, bro. Not trying to live your best life.
And keep you alive.
They're just trying to keep you alive. You know why? They're just going to feed you more medicines, bro.
More money.
More
Just a
medicines.
number, just a
And
number.
at what, like you said, my pricing, I don't even get into prices.
Your price
I literally cannot make them any lower. I tell people, it's like, dude, you can't even take your family to Outback for a meal for what I'm going to charge you,
No,
just
I
to
can
make
vouch
sure
for
that
that,
I
man.
can get your, get that includes medicines, bro. That is literally, I don't look for the profit margins. I'm looking to try to just expand knowledge and get people just living their best life, bro. It's just crazy. I
all it's
enjoy
about.
what I do. I never work. Literally, people, you say the same shit. You never work.
I don't work.
I don't work,
I'm tired of shit, but I don't work.
bro. I don't work.
Yeah.
I
really
enjoy,
don't.
I can
He
talk
comes up
all
here and gets on
day,
this
bro.
register, bro. He's like, I love this shit.
Bro, I can do it every
You got
day.
Rufus Du Sol playing. You're drinking
Dude,
a cocktail.
if
Like, he's like,
any day you have
Sure.
nobody to fill your schedule, I'm 15 minutes up the road. I will be here tomorrow if you wanted me
Oh,
to.
we're doing part two.
So
Oh,
for all the assholes that think they're too busy, if they come in for a physical consult,
They don't have to come in.
They don't have
do
to
it
come in.
virtual.
so we can be virtual.
all virtual.
like a Zoom.
There
kind of
is
thing.
no need. If you feel like you are so busy that you can't take 30 minutes
These are
out
real
of your
assholes.
life,
Yeah.
that you can't take 30 minutes out of your life
These are
to
real
come
assholes.
down. I literally employ a phlebotomist that does not make me money because I make it convenient for my patients. I pay the phlebotomist to be there in-house because I just like convenience. While you're there, you get your blood drawn. I use a local lab, AEL. It's on Seaway Road.
And I love the fact that it's Seaway because I live on the island.
Yeah, Seaway. Oh, you're right there.
Yeah, I know.
I'm literally right around the corner.
Well, I know. So Jock's building the houses.
Yeah.
Across from my house. Me and
So
Jock.
me and you, we'll go to Kendrick's in a few days.
Hey,
Yeah.
let's all go as a group. Yeah,
Dude, I'm
group
literally.
trip.
I just try to make it as convenient. You have no excuse. I try to give a person.
I want to focus on Scott. Scott, my stepdad.
Yeah.
You're gonna love Scott.
Dude, I try to give someone no excuse.
Yeah.
Not financial,
Yeah.
not convenience, not time, not location.
So my stepdad's 78 and he's a badass. He's a big part of the casino's been written here with the typewriter.
Good.
And he's 78. He rocks. He's just y'all love him. Come on.
Oh, yeah.
Is it?
Dude,
Good's the man.
No,
I'm
Scott's
glad
amazing.
you bring that up. You know what the age restriction is? There is none.
Yeah.
There is no age restriction.
I told us. I said, Forever Young's coming on. Kendrick's coming on. I said, look, because he naps from time to time, a little bit here and there.
Yeah.
I said, if Kendrick keep you up for another 20 years, we'll do it. He's like, sure.
The oldest guy I got, and of course you can't use names. It's medical. I got a 91-year-old guy. He's a judge, and he just said, I'm not ready.
No.
I'm not ready. He
Fuck
said,
yeah.
I'm an avid. He was an avid runner. He's a performance guy. I said, cool. I got you. There is no negative because I'm not introducing a foreign substance. These are all hormones that your body naturally produces. It's crazy. People can't understand. Oh, fuck, testosterone. What?
What?
Like, dude, you make
Anabolics,
it.
illegal.
Bro, you
illegal.
make it.
Yeah.
You make it naturally. So there's no age restriction. Now there's some stuff when it talks to cancers and stuff like that. And that's where the consultation comes in. And I'm just super savvy. You know, I look in the family dynamics and I look at your past medical history, and anything that I ever implement is never going to be a contradiction. You know, testosterone doesn't cause cancer. Estrogen doesn't cause cancer. Anything that you've ever heard, there's most likely a lot of misinformation. And we could do a whole nother session on that.
That's a brilliant person. You're brilliant.
He is.
Yeah.
He is.
Well, look at that camera.
Give us that spill.
Tell us how
Forever
our
Young.
viewers get in touch with you, how they set it up, and how it goes. Let's go.
Everybody that tuned in, I appreciate it. Thank you. Kendrick McCarty here, Forever Young, men and women's health. Please feel free to reach out. I would love to have a consultation with you. If you have questions, please reach out.
A little more mic on the mic. A little more mic.
I have a website as well. Even if you have questions, I have a lot of theory and literature stuff on my website, fygulfcoast.com. If not, please feel free to reach out to my office, 228-363-6623. I got a great staff. If you can't pick up the fact that I really care about trying to make you live your best life, you're not listening to the same podcast we're doing. So
That's it.
live life and come and see me.
Cheers to Forever Young, baby.
Yeah.
Cheers, brother.
Let's go.
I love you.
Cheers, brother.
Cheers.
I appreciate it, man.
Let's go.
I've been waiting for that for the past 13 years.
Thanks, y'all, for checking in on episode 75 of Them District Boys Podcast. Y'all don't forget to mention Them District Boys Podcast when y'all do go Forever Young, so he knows where y'all came from and that y'all saw all this and you already know what's up.
And then real quick, just to my Uncle Tommy, man, thank you so much for taking care of my dad's funeral and being that man. Love you, bud.
Tommy
You the man,
Socius, thank
Tommy.
you. I know
Everybody
it's been a little while
check
since I've
out
seen you.
Image Striping Company, Tommy Societ. He is the man. Y'all have a wonderful night. Thanks again for checking in.
Kendrick, thank you.
Thank you.
Kendrick, thanks so much, brother. You're the man.